And we're live.
All right.
Welcome. Hi. Thanks for joining us, Sumana. Sumana Moole. I've said your last name correctly.
Yes, Moole, but yes, I've
Moole.
anything
Thank you.
works. Yes. Thank you for having me.
Thanks for coming. Tell us about Dr. Moole is a physician, and tell us about your practice.
Yeah, so I'm a gastroenterologist and I am here in the suburbs of Atlanta. We focus on not just gastrointestinal conditions, but we also take a holistic, integrative approach on the root cause of the problem and gut health. And we try to improve the patient's gut health and prevent the conditions from recurring. So we've been in this practice for about 2 years at this location in Johns Creek.
Very good.
Mhm.
I'm going to put your website up here. There we go. Sorry, I had it kind of slammed together with your
Mhm.
Instagram, and we'll make sure this is easy to click for folks. Very good. And so, brave of you to be stepping out on your own in a private practice scenario. How long have you been in business?
At this practice, two years, almost two
Excellent.
years in this summer. But yeah, I've been doing this for quite a while. Graduated from Penn State in 2009, so 14
Mhm.
years in gastroenterology and longer in medicine. Yeah,
Yeah.
yes,
What
long
are the
time.
common conditions that you treat in as a gastroenterologist? What are the common things that you see?
Yeah, so I'm focused in outpatient gastroenterology. So we see a lot of things that don't necessarily need to go to the hospital, which, but then are equally or more annoying and bothersome as any other serious GI condition. Things like bloating, things like constipation, acid reflux, abdominal pain. That's not bad enough to get you in the hospital, but still a bother, and that occurs from time to time. Cramping, nausea. These are some of the more common things. And of course, screening colonoscopy to prevent colon cancer is something everyone needs at 45. It was 50, it changed to 45 just this past year. And all insurances covered the screening colonoscopy, which most folks haven't realized that yet because it's a recent change. So that's yeah, all those
That's great.
conditions are common.
Well, and so the overlap, I would say, my audience, the people that I'm here to reach are people who have challenges with chronic pain. Um, but I think one underappreciated connection is how the gut and the brain are connected.
Mhm.
And the brain matters a lot for people with pain because that's where we process and experience pain. So it's important to have good brain health and optimize that however that we can. But the connection of the GI and the brain, to me, it's just not something that I really would have appreciated without having some medical training. Tell me about the gut brain connection, and what does that even mean?
Yeah, so that's a great question, and it's a very fascinating yet complex topic that is being that's going through extensive research and mostly in mice and also further studies now. So the gut brain axis, or the GBA for the short term, is basically the connection between the brain, our central nervous system, which is our brain, and the brainstem, the spinal cord, and then the enteric nervous system, which is these tiny nerve fibers that are lining the gut, large intestine. When I say gut, we are kind of mostly talking about the large intestine here, which is the colon, which is about 4 to 6 feet long. And the interesting or unique thing about the gut, large intestine, is that there's trillions of bacteria in that, and we often think of bacteria as bad things, but in this case they're good bacteria, mostly good bacteria, and a combination
Which
of
is so
bacteria.
interesting.
Yeah, it's that
Like it's
homeostasis.
unbelievable to me. You've got 4 to 6 feet of colon in here and trillions of bacteria. Like,
Yeah,
how is that even possible, right? Like,
yeah, yeah.
I'm a physician, yet my mind is blown.
Right, and about at least 2,000 different species in each of our,
What?
yeah, intestines. Yep,
2,000.
different species.
Now, I think my limited knowledge of GI and species of bacteria, I was thinking they're kind of like big groups, and but even those big groups might reflect a bunch of different species in them. Is that right?
Right. There are so many, I mean, there are so many different ones. I can't even begin to say the names, but the bigger
That's
ones
okay.
are Lactobacillus,
We won't know.
Firmicutes, and Bacteroidetes. So those are the big
Uh-huh.
ones, the big names. And those are the ones that we think of as anti-inflammatory. If you have more of them, it's better for you. You see less of these in my studies in mice who have inflammation with inflammatory disorders in them. You might see less of that. So there's a whole homeostasis, or like a balance between
Mhm.
the good bacteria and the bad bacteria, and also there's some viruses and fungi in there as well. So that
Well, and here
milieu. Hmm.
I have a couple of questions, if I may,
Yeah.
um, just to keep it on the level for patients and folks that are curious.
Yes.
Um, there are studies where they took mice, right? And they had those mice have no bacteria in their stomach.
Right.
And I think those mice have health problems, don't they?
Absolutely. Yeah. Yeah.
I think from as a pain doctor, they're more sensitive to pain.
Right.
And actually, when they reintroduce these bacteria, to my recollection, the mice do better. I think it's just amazing how interdependent, I guess, that we are with these things in the gut. I
Yeah.
think it's going to come say hi.
Yeah. Absolutely.
Thank you. That's my dog. That's me. Okay. All right.
He
Now I'm gonna
wants
have
to.
to start again.
He wants to say, yeah, yeah. He wants to participate.
She will. Okay. And so there are bacteria
There's
and fungi and viruses
Yep.
even.
Yep, viruses even, and it's the homeostasis, the balance is what matters. And these bacteria, microbiome, when we say microbiome, we're talking about all of them. They interact with the lining or the cells in the gut, the mucosal lining, and then that creates this secretion of chemicals that then go through several pathways, whether it's hormones, through the nervous system, and then they connect with the cognitive and the emotional part of the central nervous system to the peripheral intestinal function. So there's a bidirectional interaction between the central nervous system and the gut. So one might affect the other and vice versa. So going back to, did you ask about chronic pain in your patients? So if
Yeah.
patients that you see chronic pain, there is often like dysbiosis or change in this homeostasis. So the bad bacteria might be more and not the enough of the good bacteria, and that causes inflammation and even hyperesthesia, which is you just pick up pain signals more.
Hmm.
So yeah, and
And
that's
so, how do we know if we have dysbiosis? Do we have measures for this yet? I'm not sure that we do, but maybe there
right.
are.
So those are all still in the research world, Sarah, that
Hmm.
just are not available. I mean, there are actually a few kits that are commercially available, but whether they really are in, I mean, we don't know what to compare to, whether that's that, or there are some kits, but it's still in mice models and in research studies that they're looking at what are the ways of measuring these microbes and what do they mean.
Right.
So it's still in the stuff.
And maybe, and probably we all have a slightly different microbiome, and there's probably a range of normal and okay, and
Absolutely.
a range
Absolutely.
where it
Yeah.
gets into
Yeah.
the negative or inflammatory way. Now, is dysbiosis, or this idea that you could have an imbalance in your gut bacteria, what would be the factors that would lead someone to have that problem? And
Mhm.
I guess my second part of the question is this the same thing as a SIBO, or a small intestinal bacterial overgrowth? That's a word that I have
Mhm.
patients
Mhm.
who have investigated that
Absolutely.
diagnosis.
Yeah. No, great question. So dysbiosis is basically what causes dysbiosis. Several things. I guess number one is anything that disturbs the bacterial population. So antibiotics, right? When we take antibiotics, someone is exposed to, has a lot of infections, they've been taking antibiotics, absolutely their bacterial the homeostasis is changed. Any other inflammation that's going on unrelated to the gut will also affect, because it's a bidirectional interaction. If they've stress, increased cortisol hormone because of stressful situation in life, other inflammatory conditions that will affect the gut microbiomes as well. Um, and similarly, so then that opens up the thought that could we change the gut microbiome and perhaps maybe change the inflammation in the body and maybe even chronic pain. So those are avenues that are still being looked at, and there's so much more to find out, and we'll know in the next coming years. And going
So it
back
might
to
be a tough
Mhm.
diagnosis to get, I guess. It might be hard to know for sure if you have this problem.
The dysbiosis.
Yeah.
So for now, the FDA approved stool tests that we have really only pick up C. diff. C. diff is like, okay, this really bad bacteria that comes in after somebody had antibiotics and that causes even worse diarrhea, which needs a different kind of antibiotics
Yes.
followed by probiotics. So it gets confusing, but that's the only really as much as our stool tests that are FDA approved go. But beyond that, there are some kits that look at, oh, this is the so far known. It's a developing field. So we do have some kits
Okay.
like Biome and other companies that do look at bacteria and say, oh, you normal population have so much of this and so much of this, but you have the opposite. And so we suggest this and this change, which may be dietary or supplements, things like that. But
Okay.
since they did not go through research trials, you got to take them with a grain of salt, with caution, and see if they mean what they mean, and they've not been verified in a strict trial conditions yet.
Right.
Yeah.
Right.
So,
And I suppose if the testing services are the same services that are maybe selling a supplement, then that leaves it
yep,
open
exactly. Yeah, and they do.
to
Most of
criticism
these
that
do.
that's what it's for.
Although I think that's the beginning stages of where we might eventually see FDA approved, like a gut microbiome kit, evaluation kit. We're still ways from getting one, but some are available.
And is there a breath test for certain
Breath,
overgrowth
yeah, breath
also?
test is mostly for like the stomach bacteria, which is different than the gut microbiome, and that is H.
Okay.
pylori. H. pylori, yes, there is a breath test, and that's just the one single bacteria you might find in the stomach. Generally, no bacteria because of the acid in the stomach, and it's just a different setup. So if there is H. pylori, definitely need to be treated for that, because it can cause inflammation, ulcers, and other nasty things. But
Okay.
yeah, going back to your second part of your question, the SIBO part, the small intestine is generally not an area where there's a lot of bacteria, maybe a little bit, but not too much. SIBO stands for small intestinal bacterial overgrowth, and that's basically means this individual has a lot of bacteria in the small bowel, and so these bacteria are causing bloating, perhaps loose stools, and diarrhea as well. And for that, we do have some tests, SIBO breath test kits that we can detect levels of methane in exhaled air. If that's when do we see SIBO? SIBO is oftentimes when the flow through the small bowel isn't flowing through because of surgeries. There's a narrowed area, strictures in the small bowel, elderly population, and those sort of things. And if we see that, perhaps we consider treatment with antibiotics, because we generally don't expect too much bacteria in the small bowel. Yeah.
And how are you going to diagnose that a patient has the bacteria in the small bowel?
SIBO is a diagnosis of exclusion, but there are breath test kits.
Oh,
There
okay.
are yeah, test kits.
Got it. So beyond the pylori, you can get the breath test for the
Yeah,
SIBO also.
they look for a very specific, like methane and yeah, in the exhaled gas. Yeah.
Yeah. And what's been your experience and success in treating patients who are positive for these problems? Do you see them get improvements if they get the right treatment?
SIBO is, about 60% success, because oftentimes it's not just that, there is other factors going on, but if we're able to identify everything, lifestyle, dietary factors, so on, that they do work, but they do get most of the time transient relief, like for a few months, and then the symptoms come back again. So that goes back to maybe there is something more than just why is the bacteria building up in the small bowel? There is
Right, right.
perhaps other factors going in. Are they exposed to a lot of antibiotics? Are they
Yeah.
have a stricture in the small bowel? And that needs to be looked at.
Mhm. Could diet play into a SIBO, or I guess it probably would take something more than just an imbalance in a diet to get to develop
Right.
that
For
problem.
SIBO, yeah. For SIBO, it's just antibiotics. Yeah, not so
Ah,
much diet or probiotics as such. Those would
mhm.
be more large intestine. It is strictly antibiotics. And um, so Xifaxan is one of the gut-specific antibiotics that rifaximin, that we
Okay.
use to treat the SIBO. Yeah, that's yeah. So
Yeah.
small intestine, we generally don't want bacteria, but the large intestine, yes, we do want the bacteria. Do you see that in your patients, or do you treat them with probiotics, or do they have a lot of gut complaints as well as?
I do have some patients with gut complaints.
Mhm.
We have probably a higher than average proportion of patients in our practice also with Ehlers-Danlos syndrome and mast cell. And
Mhm.
in this population, I have seen multiple folks who might have concern for
Mhm.
small intestinal bacterial overgrowth. It's not something that I necessarily treat.
Right.
And in fact, I tell some of those patients, in some ways I serve a little bit of a primary care function for them, because I might say, hey, you need to go see the GI doctor about this
Mhm.
problem, or hey, what would be a GI doctor that I could direct them to if they were having gastrointestinal issues. So
Mhm.
it's important in my practice to have those resources, and certainly I'm, as a physician, I'm very comfortable recommending a probiotic just as a supplement, as
Mhm.
something
Mhm.
that's safe.
Mhm.
Personally, I take one sometimes myself as a supplement that, I think it's, I think gut health seems to
Yeah.
be important, and it has many influences. And if you're a good diet is probably the best treatment to maintain your gut health. But
Right.
since we don't all have a perfect diet, then maybe we have room sometimes for a probiotic.
Right. Right. So you do see a lot of
And I
SIBO.
have had some patients who, yeah, and I have had some patients who have complained of constipation, and as part of re-regulating their bowels,
Mhm.
uh, where they've felt like using a probiotic for a time
Mhm.
did seem to help them kind of re-regulate themselves.
Yeah, yeah, true. It does. Yeah, I think it's once we are able to find out or figure out ways to find out which specific bacteria or what's the imbalance, what do they need, then it could be more of a targeted approach, replacing that particular microbiome in that individual rather than just giving a overall a random probiotic which may or may not have what this individual is missing. So I think that
Right.
targeted approach is missing right now. And that's one of the most frequent questions we get. What probiotic do I get? Oh, take a probiotic. Which one? There's so many on the
Yeah. Are they
market.
all the same?
Right,
Yeah.
right. So
I
for
feel like
now, yeah,
I feel
yeah.
like are a lot of them like lactobacillus? Have I seen that
Yeah,
on some of the
lactobacillus
labels?
is one of the most cultural, is most common one. But we
Hmm.
generally say pick something that has like three different strains of bacteria. Read the names, just have three
Okay.
different names, and then if you're going to be on them long term, rotate the brands. Just go check out the different brands, and you might hit something that you're like, oh
Huh.
yeah, that I'm feeling much better now. But that alone, it never is a treatment enough. Like you said, I think dietary factors, lifestyle is the bigger one, right?
Hmm.
Not putting in too many antibiotics, enough fiber, hydration is a big thing, which a lot of people ignore. Enough fluids,
Yes.
like about 2.5 liters. Even me, I don't think I get that much fluids in the day. But yeah, water, exercise, sleep, and not too much alcohol, all of those things. Yeah.
Well, and there's probiotics and prebiotics, right? So these are
Hmm.
two words that are very
Yeah.
similar.
Yeah.
Remind us of the difference between those two.
Yeah, prebiotics are these non-digestible fibers like inulins that form the
Mm.
substrate. Then you grow your own bacteria in the gut. So they're kind of the fodder for the bacteria to grow. Probiotics they're already there. They're going in. Hopefully, they're colonizing and improving and settling down and multiplying the right kind.
And if you were repopulating your gut, you might need both
Repopulating,
probiotics
yes,
and
you might need both. Yeah, I mean, prebiotics, I guess you need, yes, exactly. So if you don't have enough of them to begin with, you need some of the bacteria to come in a live form and then the substrate, and then they would multiply. And then,
very good.
yeah.
Very good.
It's it's an
I'm
interesting,
interested.
yeah.
Yeah. I'm interested too to hear a little bit about the impact of stress and anxiety. I know when we spoke prior to coming on, you mentioned that that's something that you have some awareness of as a GI doctor. And I would say, you know, a lot of my patients who have chronic pain, they may have anxiety, at least around their pain condition, or they might have generalized anxiety. What are the impacts or overlap with the GI system of stress and anxiety?
Right. So stress and anxiety are the cognitive functions of the central nervous system. So if there's something going on there, then it gets relayed through the same gut-brain axis to the gut, and then there's a change in the gut bacteria. The immune cells and the epithelial cells, all of them interact with the enteric nervous system, and these same people have a lot of times IBS-like symptoms: irritable bowel, bloating, visceral pain, abdominal pain, are common in folks with anxiety and stress. And that's because of the increased visceral sensitivity that develops with the change in the gut. It all goes back to the same thing. There's change in the gut bacteria triggered by cortisol, triggered by stress and anxiety. There may be some role in if we corrected the dysbiosis, the gut microbiome, maybe these, even autism, there's so many studies, autism, depression, and stress and anxiety, the role of correcting the gut microbiome. That, of course, I don't think that could be the only thing that you could correct and everything else would fall into place, but that might be one of the targeted approaches to correcting these cognitive conditions or the stress and anxiety disorders because of the close interaction.
Yeah, I think that's just really remarkable, and in a certain way, like empowering, right? If we can work to have a healthy gut, to have a healthy body, you know, that can help us get certain diagnoses, certain problems back under control, and you know, take charge of them, right?
Absolutely. I think there's supporting what you said. I think there's actual studies that showed when you change the diet in a subset of, I think, patients with anxiety and depression, to increase the fiber, decrease processed foods, and decrease sugary items, and they've seen a change in their depression for the better, and the anxiety as well, probably again, which affects the gut and then back into the central nervous system. So yeah, there's a lot we could do by lifestyle changes and focusing on good gut health.
Yes. But I think that's hard. Yeah, I think that's exciting. It can be hard to hear, you know, to need to make lifestyle changes. On the other hand, I think it's empowering in another way, that it's something that we can control and that we can improve ourselves.
Yeah, absolutely. There's actually a great TED talk by a psychiatrist who did this nutrition study, and that has like very high views on the same thing. She actually did studies on change in the diet and then the change in symptoms over a 3-month period.
Oh.
Yeah, it's and exercise too, right? Adding exercise and adequate sleep, things that we often forget. And when we correct these, and it's amazing, a lot of patients just respond. In our practice, the simplest thing I see is just adding fiber to the diet. A lot of cramping, bloating, constipation, abdominal pain. And this has been going on for like long time, sometimes even years. They've done colonoscopy, everything is normal, tried laxatives, but somehow they didn't get a chance to add enough fiber in their diet, which is hard, of course, with modern lifestyle. You're on the go. It's hard to keep up with your fruits and vegetables. But simple things like psyllium husk, which is what is in Metamucil, the plain, there's the organic plain psyllium husk that's on stores. That's like my to-go fiber for everybody. Pick up like a big tablespoon, stir it up in water, drink it, and then make sure you get 2.5 or 2 liters of water every day. And most of the time, like 80 to 90% of the time, those symptoms that they've been having for a long time, they're gone just by adding fiber
Wow.
and fluid to things. Yeah.
And most patients would continue that
So
fiber, and
that's
our
the
guts
tough
are
part.
made.
And no, once they get better,
Okay,
they forget, and they're like, "Ah,
sure.
yeah, I'm good. It's hard to take. This is a very thick fiber." It's
Yes.
I can't blame them. It's hard to keep up, once you're feeling good. But once they've made the connection that, okay, I'm taking fiber, I'm doing the fluid, I'm doing great, I don't feel the bloating, I have my appetite back, I feel empty inside, which I didn't feel in a long time, they at least know where to go back to. So they learn that that's what made them feel better, and they can go back to. So it's a learning process that, oh, that simple thing I never knew would actually help me. So I really didn't even
Yes.
have to go to prescription laxatives for constipation in a long time, because most of them are do quite well just right there with fluids and fiber.
Wow. Yeah. So really, and Metamucil is your
Yeah,
favorite,
yeah, and yeah, even
and or I guess Metamucil is
right,
the same
right.
brand,
It's the
but there's
same thing. Psyllium
other
husk
versions of
without
psyllium.
all the sugar and
Yeah,
the flavor. Yep,
psyllium,
yep. Yeah.
generic. Yeah, sugar free if you're diabetic.
Terrific.
That
Yeah,
right? It comes
yep.
with
It-
sweetener or not sweetener. I think I've seen it.
right, right. Yeah, they get like store brand psyllium husk. Yeah.
Yes. Um, tell me about what pearls you might have as a take home for someone who's looking to improve their overall health, improve their gut health. They might not have a specific GI complaint. What would be your top wellness tip?
Yeah, I think this,
GI
what we
wellness.
just talked about, I think would be the number one thing. Really, it all goes back to lifestyle. Get your fiber in, whether it's dietary, if not psyllium husk. Make sure you're drinking enough water. That seems to be a big downfall of modern, even in kids, right? My kids go to school, they bring their water bottle back, nothing is, it's full. It's full. I'm like, how did you survive all day? Yeah. So make sure you're drinking your water and keeping up with the fiber. Exercise, as we know, is important, that your gut moves with mobility. So the more you move, the more the gut moves. And sleep is an essential factor, as you probably have seen in your chronic pain patients, right? It goes again both ways. You sleep well, you have less pain,
Mhm.
or yeah. So, and if you have pain, you can't sleep. So it's yeah, if possible, keeping a
Can be a
good.
vicious cycle. Yeah. Yeah.
Yeah,
And sleep impacts the gut. I don't really think about sleep impacting my GI
sleep
health at all.
absolutely impacts the gut. Every lifestyle, factor impacts the gut, and so yeah, adequate sleep is definitely important for inflammatory, conditions and general inflammation too. So yeah, keep up with lifestyle, fiber, fluids, and your sleep and your exercise, and most of the common GI complaints, at least, you could ward off by doing that.
Wow.
Yeah.
That's awesome. Thank you for these pearls of wisdom. That is great stuff. And I appreciate all that you do, Dr. Moole. Tell us about your practice and your location again, if you're in the Atlanta
Uh,
area,
yeah,
for Dr. Moole.
yeah. It's Merus Gastroenterology and Gut Health. We are in one of the northern suburbs of Atlanta, in Johns Creek and Suwannee area. So it's just one location right there. And yeah,
Wonderful.
yeah. So,
Well, thank you so much for being with us.
oh, thank you. It was fun.
Okay. We'll
Yeah,
see you
thank you for
again.
having me. All right.
Okay.
Bye
Take
bye.
care. Bye.